this talk, which there's a couple of names for this talk, the safety pin cycle or the importance of the nervous system in health and disease. The most important chiropractic talk that I do is this talk. I do talks on a lot of other things. We do talks on nutrition, we do talks on brain health, we do talks on over-the-counter medication and how that destroys our bodies. But this is the main talk, the main information that I want people to know about chiropractic and what I do in this office and how it works. So, and this is a true statement, by the way. Health is a natural state. It's not natural, it's not normal to be sick. You know, those television commercials they used to do for Excedrin, you know, for that ordinary morning headache. Remember that? What's so ordinary about a morning headache? I mean, that's just a ridiculous commercial. It's normal to be healthy. My job as a physician is not to shove people into a state of health, but to remove barriers so a patient can be healthy. So if we look at the nervous system, we can compare it to a safety pin, okay? This is an easy way to remember it. You got the brain, you've got the body, and then you've got these pathways between the brain and the body. And these pathways are your nervous system. So you have the afferent pathway, which I'll show you, which comes the efferent pathway, which comes to the brain and the body, and then the afferent pathway. And when you get a subluxation, that interferes with these pathways. Now, all doctors who, with the intention of expressing life in the body, understand the system. They know the system and they utilize it. So if you look at what happens, this is not like a chiropractic philosophy. This isn't a chiropractic thing. This is a scientific fact about physiology. Is the body sends messages to the brain to let it know what it's experiencing. The brain sends messages back to the body telling it how to adapt. These are loops of communication and they're constantly going on all the time. Now, if we look at the way our body is set up, we have the autonomic nervous system. You've seen this chart in my office, or something similar to this. You have nerves that go to all the organs of the body that come out of the spine. So I'm going to ask you a question. It's not on this slide. What do you think happens to the immune system when we get adjusted? Think it's worse or better?
Better.
Better. Why does it get better?
They're helping it to communicate.
You've opened up the pathways.
Yeah, open up the pathways. By the way, where is most of the immune system in the body? Where is it?
The gut.
Gut. That's right. Great. I'm glad you guys got that answer. Yeah, it's in the gut. Okay. So when we get adjusted, basically what you're doing is you're stimulating and energizing the immune system. Now, the reason I brought that up already is because I have people that call us up. I took a phone call this morning. I was the only one in the office, and I really like this patient a lot. She's watching, so I'm not trying to diss her or anything like that. She says, I think I'm catching a cold. Is it okay if I come in? I don't want to spread it. Well, that's why you should come in, okay?
Get adjusted.
If I'm catching a cold or if I'm getting the flu, man, I want to get adjusted. I want to get my immune system stimulated. I mean, think about these people that walk into medical doctors' offices that are deathly sick.
Okay.
Do they have a better immune system than I do? I mean, am I going to catch something because I'm a chiropractor, but they're not going to catch it because they're a physician? No. Okay? So you get sick, you come into my office, we want to adjust you to get your immune system functioning as well as it can. Now, if you come into my office and you're drinking a 32-ounce Coke, it's probably not the best thing for the immune system, okay? But so you want to drink water. But that is the issue. That's the thing with the immune system in chiropractic. It stimulates it. Now, anybody that does not know this or respect or understand these pathways before administering a diagnosis is violating one of the fundamental laws of life. It's really, really important. And I'll give you an example of why that's important. One of the things that I do in my office is I do vagal nerve stimulation. We're going to do a talk on the vagus nerve next month or later this month. And the vagus nerve is part of the autonomic nervous system, the parasympathetic nervous system. One of the things that I found when I stimulate the vagus nerve on people is a whole lot of things get better. Like anxiety gets better, depression gets better. I see breathing, coughing, all kinds of things get better when I stimulate the vagus nerve. So if you don't know that the vagus nerve might be a problem causing all this stuff, what are you going to do? What's going to happen if you go and get a diagnosis and treatment for that?
They're going to put you on pharmaceuticals.
Yeah, you're going to get drugs for them.
Yeah,
Pharmaceuticals.
antibiotics most likely.
Yeah, for something that you can fix by just fixing the vagus nerve. Okay, so let's talk about nerve supply. How important is the nerve supply from the brain to the body? Okay, well, you know, what happens when you cut the source of the nerve supply off, which is the head? Now, French found that out. You know, you cut the head off, guess what?
Yeah.
Die instantly, okay? So the electrical supply from the brain to the body is completely severed. And so what does that tell you about the importance of the nerve supply from the brain to the body? You cut the head off and you die instantly. What does that tell you?
It's important.
Yeah, you can't live for a second without it. That's what it says. And you cannot, I mean, you can live, and I've gone through this before. You can go like 60 days without eating. You can go, 3, 4, 5 days without water. You might be able to go 3 minutes without breathing. But you can't go a second without that nerve supply to your body. Now let's look at another scenario. A partial severing of the nerve supply from the brain to the body. Much, but not all the nerve supply is cut off. That happened to Christopher Reeve. He had that horse accident, okay? And I liked him. I thought it was a tragedy, and he went downhill, fairly quickly after that and died several years later. But that's what happens when a lot of it's cut off. But bad scenario number 3, what happens when some of it's cut off, just some of it? That's what we call a subluxation. They interfere with nerve supply from the brain to the body. A minor subluxation can cut off as much as 60% of the nerve flow to an organ or muscle. So what is a minor subluxation? Well, if you put the weight of a dime on your hand, that'll cut off that much pressure on a nerve, 60%, cut it off, okay? But you may not even know it. We're going to talk about that in a minute. So chiropractors, we're trained to do this. So subluxations, they aren't as bad as scenario number 1 or 2, but they're significant issues when it comes to our health. So the subluxation that causes pain will eventually destroy your spine if it's not corrected. In other words, you can have degenerative arthritis in your spine for a long time without pain, and eventually that's going to fuse that. You're going to have problems. So let's look at the brain. The origin of life is triggered by what happens in the central nervous system. The brain is constantly, it's doing its best to make these endless observations. And if you burn yourself, you put your hand on a hot stove, the brain immediately knows, starts making the corrections to cause inflammation, swelling in your hand, and doing the steps to heal it. There's no evidence that a healthy brain can create sickness in the body. Okay? Even if you never exercise to keep your body vibrant and alive, and you eat junk food, the body's going to try and keep you alive. It's going to do everything it can to keep you alive. How many of you know people, you look at what they eat, you can't believe they're still alive. I see people shopping like that. You go, God, how do they even push their cart?
Drink beer, eat potato chips.
Yeah.
French fries,
Coke and
Coca-Cola
chips.
all the time,
So your body will do its best that it can, but once it can't adapt anymore, what happens? What happens when the body just can't adapt anymore?
It gives up.
Sickness.
You get sick and you die. Okay, you die. Okay, very important that your body can adapt. So when we talk about healthy brain, just based on some of the other talks I've done, what would make a brain unhealthy? What would cause a brain to be unhealthy?
Smoking cigarettes, drinking beer, all
Okay,
the
so
time.
alcohol.
Excessive.
Alcohol.
Yeah.
Okay, that'll do it. What else?
Stress.
Stress. Oh yeah.
Oh,
Yeah.
yeah. Anxiety.
Elevated cortisol. Okay. Good answers. How about eating too much sugar? You know, having insulin
too,
go sky high, sugar go that'll mess your brain up too. So your brain can be made to be unhealthy, and eating too many French fries. Okay. So recent research published in Scientific Reports, it's July of 2021, demonstrated that loss of curve in the neck diminishes neurological communication from the brain to the body and the body to the brain by 30 to 40%. When the curve is restored, normal transmission is also restored. The same is true with blood supply of the brain. When the neck is not curved properly, the vertebral artery is kinked and the brain does not receive normal blood supply. This has also been verified by research. So here we go. This is what a normal neck should look like, nice curve. This is what a reverse curve looks like. So it stretches the spinal cord and stretches the vertebral artery, and you don't get the blood supply to the brain that you should, okay? And this has been verified by research, but nobody will ever hear this unless they come to one of my talks, or one of my friends' talks who's talking about this. So this is all research based. So pain is experienced in the brain. So pain may be coming more from here than from here. So if you hurt your back, it's actually experienced in the brain. Now, the reason that I'm saying this, and I have a whole talk on this, is that over time, even when this heals, you can still experience pain. So sometimes, one of the reasons that I don't ask every time people come in, how well they feel or how bad they hurt, the reason I don't ask that is because I don't want people to think about that all the time. Because if they're constantly thinking about their pain, they're doing this, okay? And if we can get the focus away from pain and onto health, that's going to really help them get better faster and get rid of the pain faster. So let's look at the central nervous system. Our body starts with two cells which divide, sperm cell and egg cell. They come together, divide like crazy. First thing that's formed is what's called the notochord. It's a brain. It becomes a brain and the spinal cord. Okay? First thing in the body that forms is your brain. Brain and spinal cord. Okay? Why do you think that is?
Everything comes from that.
Yeah. Everything else, your brain starts directing where everything else should be formed.
Yeah, the
okay.
organs and all that.
Yeah, the brain, the spinal cord, the nerves, and then on the organ, then off the nerves, the organs form. Okay? The organs just don't form just out there in space, and then a nerve, just kind of looks for it until it finds it. Okay? The nerves form, and then organs form off the ends of the nerves. Okay? So the body tries to protect things. Now, I say this in my X-ray reports. Vital organs are protected by the ribs. That's a good thing. So if we look at the central nervous system, that's protected by bone, the brain or the skull and the spinal cord, spinal column. By weight, bone is 9 times stronger than steel. So is it a coincidence that the most important system in our body is encased in bone? No, it's not. Subluxations have been described in 4 ways, and I'm not going to spend a lot of time on this, but dysfunctional movement of a joint irritating a nerve, They've been described as inflammatory process of ligaments and discs and other tissues surrounding the nerve where they exit from the bones. Outright compression of a disc, and you can see that oftentimes on an MRI. Or an electromagnetic charge with an inflammatory response creating tissue changes which emit alteration in tone and electrical field. Well, I think all four of these are true. All four. They're all true. Okay? The scientific evidence proves that when people with this form of dysfunction, they're adjusted, they get better. They just do better. Now, there's 3 ways to look at chiropractic. This is actually pretty important. You ever met anybody that didn't believe in chiropractic? Oh yeah. So I mean, people said it to my face. I mean, especially 42 years ago when I got in practice. I mean, my gosh, people have any problem telling you are quack.
Yeah.
And they, because we didn't have the research back then. There's people out there that still don't believe in it, and they have that right. Okay. How about this one? Chiropractic is only good for pain relief. People like that. Sure. I mean, I have patients like that. They only come in when they hurt. They quit when they feel better. And I'll see them again when they hurt. Okay. That's just, some people are like that. Okay. But really, it's number 3. Chiropractic enhances the way my entire body works, and thus the expression of life and organ function. So when you get adjusted and you get your nerve supply working right, everything is going to work better. Now, one thing I've noticed in chiropractic, I've seen this in my mother who's been adjusted, I think since I was about 16. And it's one thing that chiropractic does, regular chiropractic care slows down the aging process, slows it down, okay? What do you think speeds up the aging process? Anybody?
Bad habits.
Like?
Sugar.
Bad diet.
Not sleeping.
Yeah,
Right.
sleeping,
Drinking.
terrible sleep. Right.
Drinking a lot of alcohol.
Yeah,
A lot of
all of those
smoking.
things. Not exercising.
Yeah.
Letting your muscles
Just lay around, do nothing.
Yeah, letting loss of muscle mass that really ages the body. So you can slow that down with chiropractic. Now, chiropractic is not necessarily designed to make you instantaneously feel better, but it's designed to make you instantaneously heal better. Not everybody that leaves my office feels better immediately. In fact, when I get adjusted, sometimes I don't feel better immediately. But it's designed to make you heal better, your body work better. If you study the loop between the brain and the body, let's say the brain and the liver, you think that a liver needs 100% nerve energy so it can detoxify a body?
Yes.
Yeah, okay. Now, do you think it's possible that you could have compromise in the liver, neurological compromise, and not know it? Sure. Yeah, you can. Does the heart require 100% nerve flow without interference from a subluxation to work properly? Yeah. Okay. Here's something else that will not make a heart work properly, and I think I just did a 10 minutes of truth on this. If you are low, there's a definite correlation between heart palpitations and heart arrhythmia and low omega-3 fatty acids. If you have low omega-3 fatty acids and you have heart arrhythmia, there's a correlation there. There's an article that just came out. I just got it. I think it's a couple of years old. Very interesting. Okay, so you need a proper nerve supply, but you also need the right fatty acids as well. And we just happen to do a fatty acid panel here that can show whether that you have that or not. Keith Wasung, and he's a guy that does the videos that on my TV. He stated that thinking chiropractic as only pain relief is like robbing a bank and stealing only the pens. And they won't even let you do that anymore because they're hooked to those little chains. I mean, it's like can't you guys afford pens? So here's the issue. let's look at steroid shots. Now, I'm not against steroid shots all the time. I'm not, I don't think they're always wrong. But when you get a cortisone shot, you know, what that does is it artificially reduces pain and inflammation. And let's say that the pain goes away. Has a problem necessarily gone away? No. So you may feel pretty good. You know, you may start lifting boxes again and, you know, doing everything you do. And it actually, over time, injure it worse because you don't even know you're doing it. This is not health care. This is crisis intervention, okay? Here's an interesting study in December 2019 in the journal Radiology. Here's what they state. Here's this is stated regarding steroid injections. They accelerate osteoarthritis. Steroid injections cause subchondral insufficiency fracture, meaning that under the joint, okay, it can cause a fracture into the joint. Complications of osteonecrosis, which is a bone dying off, and rapid joint destruction with bone loss. That's what that study said about steroid injections. So I'm not saying they don't work or they shouldn't be done at times, but there are side effects to them, and it's in the literature. The chiropractic process may be slower than a shot at times, but it's a lot more in tune with what your body needs to feel safe. So if your body's in pain, you think it's in pain for a reason? Okay. Your body just kind of gives you pain because it feels like it, you know. Like, yeah, I think I'll give him stomach pain. Yeah, see what, you know, like a wayward teenager. So it's like your oil light coming on. So covering up symptoms doesn't make a lot of sense. Makes no more sense than, you know, taking a screwdriver and punching out the oil light if it goes on. I mean, you're not going to have you're not going to go very far if you do that in your car. And I've never done that, but my oil light came on once when I was a teenager, and I wasn't sure what to do, and well, I blew up the engine. Not a good day for
black electrical tape and cover it.
Yeah,
It's cheaper than breaking it.
cheaper than breaking it, right. Okay, great idea. Okay.
Your dad was mad, I bet.
Oh yeah. It's out in the middle of nowhere too in West Texas. It was a bad day.
Oh.
Okay, no cell phones.
And he was a minister, and you heard some words, I bet.
Well, no, I didn't hear any bad words, but I heard some harsh words. Harsh words, right. So research has proven that even a minor subluxation can shut down 60% of the nerve flow. We've talked about this. Only 10% of your nerves that deal with pain. The remainder support function. Okay, so this is a question I ask on my first reevaluation just to see if people have watched this talk. Okay, so if 10% of your nerves deal with pain, what do the other 90% of the nerves do?
operate things.
Yeah, right. They're not in there along for the ride. They're in there because they actually make things work, and they deal with function. Like they do things like dilate your pupils and move your eyes and digest your food. So even if your liver is functioning at 40%, you might even know that there's something wrong. Okay, an individual who has a nervous system as free of interference as possible can fight off infections and sickness much easier. So children who are subluxated, they don't have any way of letting you know that they have pain, okay? But here's what they may experience. So a kid with chronic colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, all may stem from interference between the brain and the body. Now, there's other things that can cause some of this, like, you know, giving a kid cow's milk when they shouldn't have it, and other processed foods would cause that as well. But subluxations can be a big cause of that. So there's an article in a very prominent neurobiology journal in 2014 that stated the following about nerves that come from the upper part of the neck. They have a great influence over the cardiovascular and respiratory area. Okay, stimulation of these areas can influence the cardiovascular respiratory areas. This area also stimulates the entire autonomic nervous system to influence the entire health of the body. So when I lay you on your side, and I've done with this with some of you, and I adjust you right up here, that area right up there, that's what I'm doing. I'm fixing this area right up here to normalize autonomic function in your body as much as possible. So this is one reason it's hard to understand how chiropractic can work, because most people have this pain model of chiropractic. So they say, do you have to go over and over for the rest of your life? No, you don't. You can stop any time. I'm not going to chain the door and make you stay. But you can only come back when it hurts if you want to. The fact of the matter is why not have your body working as much as possible to the highest degree that it can? See, that's the issue. Why wait till it breaks down? We don't do that with our cars. So that's why we brush our teeth, floss our teeth, because we want to keep them. We brush our teeth only when they hurt. No, I know some people that do, or they act like they do, but no, we brush them because we don't want them to hurt. So Tour de France riders get adjusted regularly, not because their backs hurt, but because it enhances their performance. Racehorses get adjusted. I've adjusted horses. I saw a horse get over a chronic cough just by adjusting it, okay? Race horses do better when they're adjusted, okay? Now, I've never adjusted a racehorse. I've adjusted horses, but not a racehorse. So animals are healthier and live a lot longer when they're adjusted. So as chiropractors, we don't just adjust people to get them out of pain, okay? I'm not saying that's not important. We adjust them because it's the right thing to do. You drink water because it's the right thing to do. Right, Mike? Right. You do what's right because it enhances the expression of your life. We take supplements because it's the right thing to do. So my goal is not to get you not just to get you out of pain. My goal is to teach you to take good care of yourself so you don't need me or any other doctor nearly as much. So that's all I have tonight. Does anybody have any questions about anything I've gone over regarding the nervous system?
I do.
Yes.
Getting back to Christopher Reeves, do you feel there's anything that could have been done to help him more, to enhance his ability to get better?
Probably not. Not at the time. I don't know, maybe they've come a ways now, but that's a pretty serious injury, And when you sever your spinal cord, that's really serious. And, that's a real, that's a medical issue when that happens, and I just don't think anything could have been, they probably did the best they could with him.
Do you think today, it being so many years later, is there anything on the horizon even that could help people that are in that situation?
There seems to be some things now that can stimulate the spinal cord to, grow back better, but that's a great question. I don't know. It's kind of out of my scope, so, but we know that, putting small electrical impulses on nerves will help them work better. So would that grow a spinal cord back? I don't know, That's a really hard, that's a tough issue. The best advice I can give is when you ride a horse, just be really careful. That was tragic. Anybody else?
Was there any exercises or stretches or anything we can do on our own to, I don't know, improve our alignment or
The best thing that I know to do is if you don't have the proper curve in your neck or your lower back, to do the traction exercises to put the curve into your neck and back, because it won't matter how much you stretch. If you don't have the proper curve in your neck or back, you'll never have the you'll never be able to fulfill the potential the health potential that you could. So that's the first thing that I would tell people to do. But I think anything that preserves muscle mass and preserves the curves in your spine is going to be the thing that's going to help you a lot.
What's the traction exercise to help your back?
Lower back?
Yeah.
Well, if you don't have a curve in the proper curve in your lower back, one of the things you could do, I have some devices here, but you can roll up a towel and lay on it and force that curve into your back. Lay on it for 20 minutes, just like on your neck.
Mm-hmm.
Now, usually I give those exercises if the lower back needs that. But that's what I would recommend, is that kind of traction exercise, just like I do for the neck. Now, having said that, there are some people that have structural issues in their spine where you can only get them so far and they can't go any farther. The angle of the sacrum is one thing that can really make a difference on that. And so, if you have a very flat sacrum, you're not going to get the curves back in your spine that you should be able to get. So there are some limitations. It's like with anything, if you're my size, you're never going to be an NBA player,
Spud Webb.
Yeah, well, I know. He was an inch taller than me. So. He was 5'7". But yeah, you won't be a center. Let's put it that way.
Yeah. I have a question about the arches in your feet. There's people that have flat feet.
Mm-hmm.
Now, if you give them the proper support they need in their shoe, the increase of blood flow, the increase of the arch being where it should be, wouldn't that make sense that also, just like your neck, just like your hips, just like your other areas of your body, your joints, wouldn't that help that too?
Completely. I totally agree. Yeah.
Okay.
So if I see people with really flat feet or really pronated ankles, I'll send them over to a friend of mine who's really good at evaluating that and giving them the right arches for their feet.
Yeah.
And because that can be really important. And so, I think that's really important, and it can really help people. Yeah.
Yeah, kind of a blood flow, kind of a return the bones.
Well, it
To the
changes the whole
proper
mechanics.
arch.
Yeah, it changes the
Yeah.
whole mechanics of your body.
Yeah, it depends on how you look at it, but
Yeah, it's
it works that way throughout the whole body.
it'll change a lot of things. So yeah, I think people with flat feet could really benefit from that for sure.
Right. They
And
keep you out of the army if you have flat feet.
Yeah. Well, they should give them orthotics, and then they could.
They should send them to a chiropractor, yeah, or a foot doctor.
Yeah.
I
They
went,
may do that now. I don't know.
I went to that foot clinic, that foot place down there on Pine Lake Road, because it's advertised on the radio. And I didn't need any kind of arch support. But my dad had very flat feet, and he had to wear steel arch supports.
Yeah.
I remember him taking them out, putting them in whatever shoe he wore. And he just made it sound like it was agony to go without them. But he never
Maybe,
was
yeah.
in the Army.
Yeah.
And I think that's might have what kept him out.
So I believe in flexible arch supports. There's a big controversy about that. And I won't get into that tonight, but their arch supports are good. They're very good. So that's all I have. If you probably know some people that just need to be checked out, and we will do that. We will check people out. We'll do a chiropractic pre-screening. We do it at our expense. If we can help them, great. If we can't, we'll send them somewhere where they can get help. But we want to just check people's spines and get them functioning at their best, especially this time of year. What's cold and flu season? January and February, after people have sugared themselves into oblivion in November and December. So we want to help them get through that. Okay, so that's all I have for you tonight. Thank you very much for coming. And in 2 weeks, we're going to do nutrition basics for a healthy immunity and a healthy society. So that'll